Hello and welcome to week 2 of Advanced Physical Assessment Across the Lifespan, course 572. This week you will be responsible for learning the neurologic and mental health chapters in your BATES, which are chapters 5 and 17. You need to read the week 2 overview or listen to this. You need to watch the demo neurological exam video by Dr. Jessica Nishikawa. You need to take week 2 quiz. There will be a synchronous class session as announced by your individual section instructor or professor. You are also responsible for the body system exam video and write-up for the neurologic system. And finally due is the shadow health modules, neurologic and mental health. So first of all, let's take a look at the readings. Hopefully you all have your copy of BATES and you know how to find chapters 5 and 17. And I know it's pretty daunting without a PowerPoint to summarize everything, but I just wanted to give you some tips and let you know that the key things to learn for the quiz and for HESI and for practice are usually highlighted in the blue boxes. So this table here depicting the cranial nerves is super important, and you need to commit this to memory because you will be utilizing your cranial nerve assessment for the rest of your NP career. So you need to know the number of the cranial nerve, the corresponding name, and its function. And please note that some of the cranial nerves have both motor and sensory components, such as trigeminal and facial, where others just have motor components, okay? And some just have sensory, like olfactory sense of smell. So learn those cranial nerves inside out, upside down, and backwards. All right, know about the motor pathways, sensory pathways. Know about what a reflex arc is. That will be included on the test. Know your reflexes and what the corresponding nerve roots are. For example, when you innervate the biceps reflex, you are testing the cervical root 5 and 6. Okay, C5 and 6. L2, 3, and 4 are tested when you are checking the knee reflex, also called the patellar reflex. So for example, if you had a problem with a patient having a reflex on only one side or the other, you could likely confer that there was a problem with L2, 3, or 4 on one of the sides. And you could also determine with all these others here too, where the problem is occurring from or arising from by knowing those roots for each of those reflexes. So memorize those items in blue. One of the things that you need to review in your BATES besides your cranial nerves is the areas of the brain. So make sure you take a look. Those are in this chapter as well. And what I mean is which areas in the brain are responsible for speech, responsible for personality, responsible for language, higher processing, and that sort of thing. So as I'm going through BATES, I'm looking at some pieces here. One of the things that's often on boards are detecting the 3 Ds, delirium, dementia, and depression, and being able to differentiate which one of those your patient has, okay? So there is one confusion assessment method diagnostic algorithm, okay, to help you diagnose delirium versus dementia or depression. That's one tool you can use, okay? All right, so some techniques for examination. Usually when you do your neurological exam, you start with mental status first. Your level of alertness, appropriate responses, orientation, okay? And beyond that, if you notice a problem in one of these areas, then it's your responsibility to dig in deeper and ask more questions. So if your person that you're examining isn't oriented to person, place, or time, then you need to do something more like a mini mental health status exam, MMSE. It's also called the Fulstein's MMSE. You could also ask questions like a serial 7, where you start with 100 and you ask the patient to count backwards from 7. Ask them questions about memory, what their high school mascot was, what did they have for breakfast this morning. So those are 2 examples of one example of a remote question, what their high school mascot was, and one example of a recent memory question. In general, though, when you have a patient that comes to see you, If you usually can tell right off the bat from your conversation if they're with it or not. You wouldn't have to do all those further in-depth exams. So after you do your mental status, then you assess your cranial nerves, 1 through 12, and you need to name them in your video by number and name and what motion or sensory component they are responsible for. And then motor system, checking strength, gait, and coordination. Sensory system, ability to differentiate between sharp and dull, or light touch, or you could do 2-point discrimination. There's a few different tests you could do for sensory. And finally, reflexes. It is okay to move some of these out of order. Just do your exam in a way that makes sense to you. Usually you try to avoid having your patient come off the table and back on and sit down and stand up, so try to limit the movement, but definitely do start with mental status first. Also, some of you have some older people that you do your videos with. Make sure that you check their regular gait first before you ask them to do their heel walk or toe walk or tandem walk. Okay, so if their regular gait has some deficits, you wouldn't want to put them through a dangerous step of having them walk on their tiptoes, okay? So here's an overview of those cranial nerves again. I promise you they will come up again and again in your career, so please make sure you memorize those if you haven't already from your undergrad. And the following pages and Bates just goes through exactly how you should test each of those cranial nerves if you don't know how to test them already. Oh, and over here, this is a scale for muscle grading. It's not going to be appropriate anymore just to say that your patient is equally strong bilaterally. You need to be more specific and be able to say 3 out of 5 strength biceps bilaterally, or 2 out of 5, or whatever the number is. And there's a note here on how you would indicate that in your note. Okay, so here's more of the cranial nerves and more of the motor strength tests that you can do. Rapid alternating movement. So now we're going into the cerebellum assessment, which is a testing, checking for coordination. So there's a few different tests you can do for that. The nose to finger test, that's when the patient touches their nose and then they touch your finger, but you move your finger around. The Romberg test and pronator drift are described on page 751, and they're required elements in your video exam. And then finally, the sensory system, and there are some different tests that you can do for that. You don't have to do all of them. Vibration sense is one of the tests on your rubric, and so is joint position sense. For discriminative sensations, you could test stereognosis. So the G is silent. Stereognosis refers to the ability to identify an object by feeling it. Okay, so you put something in their hand with their eyes closed, like a pen or a safety pen, a magic marker, maybe a cell phone is something a lot of people recognize, a computer mouse, something small that they can feel. A pair of scissors would be a perfect item. And you see if they can identify what it is. Make sure you check in both sides. And the other test you can do is called graphesthesia. Graphesthesia, you would draw a number, just like it shows on my screen, in the patient's hand, and ask them to try to guess what it is, and you do that on both sides. Another test that's common is 2-point discrimination. You can pick up an open paper clip and do this easily, and you ask the patient to close their eyes and without looking to tell you if you are touching them with 1 point or 2. So dermatomes, you don't need to memorize every single one of them, but the ones shaded in gray on my screen are the important ones to pay attention to. And then finally, the reflexes. These take a lot of practice, and in your video that you turn in for this class, it's okay. You will not be failed if you cannot elicit the reflex. Your instructor knows that these take practice. The thing that we're looking out for on the video is that you do know the correct spot to hit. Okay, so take your time, practice at home, but no need to hit your patient over and over and over again in the video to try to make them get the reflex. You won't lose the points. And you do need to grade the reflex in your note, okay? Very brisk, brisker, average, somewhat diminished, reflex absent, okay? So use the scale, starting with 0, going up to 4. These are just some different tips and the locations on how to elicit the reflexes along what you're checking for. So remember, you need to memorize these, okay? What the reflex checks. So the quadriceps, aka the patellar reflex, is checking for intact L2, L3, and L4. The Achilles reflex is checking primarily for S1, sacral 1, okay? There's the plantar response. This is one of the superficial reflexes. So the other ones are called DTRs, deep tendon reflex, whereas the plantar response is actually one of the cutaneous or superficial reflexes. There was a chart, oh, here we go, the superficial reflexes. You don't have to test all of them for their video, but abdominal reflex is one of them. The cremasteric reflex, that's when you stroke the inner thigh and the patient's, if they're male, obviously their testicle moves upwards. The anal reflex, we are not checking that on the exam, but on your exam you will check the plantar response. Okay, so that's pretty much it through your exams and for the video exam. But if you keep reading through Bates, some of the important parts are at the very end, where it talks about motor neuron lesions, spinal cord lesions. Types of stroke, that's a lot more acute care and intensive care. And although it's important to know about, there's not a lot of material on the test for you. Know a little bit about the brain areas, we discussed that earlier. The biggest part is you need to study for are the headaches in the back of the chapter. There's some tables with that because those come up in primary care very often, and you need to be able to distinguish the difference between a tension headache, a cluster headache, and a migraine headache, and those are in the book. So I'm skipping right past all this. These are all things that you discussed in immersion and that you need to also verbalize in your video for cranial nerves. Okay, so these are different descriptions of gaits and postures. Okay, I'm skipping past a lot of this comatose patient thing because in primary care as an FNP, you shouldn't be seeing comatose patients. Okay, and then back to the chapter on behavior and mental health is chapter 5, and that's the other thing you guys are responsible for learning about for this not first test, but the second week test. So talks about technique of an examination. This is a lot of the mental status that you would do for your video too, just a quick A&O times 3. You have to check their recent and remote memory and their reasoning and judgment. So here's a little thing about judgment. You could ask your patient, how do you plan to get help after leaving the hospital? Or if you have a patient seeing outpatient, how are you going to manage if you lose your job? A good question to ask too for judgment and reasoning is if you're assessing your patient, elderly patient, you're worried about dementia, is what would you do if you were walking by a house and it was on fire? And of course, you're looking for the patient to answer something logical like, I would call 911 or I would try to go get help. We talked about digit span and trying to add a series, or we talked about subtracting 7, serial 7s. You could add a series of 3 numbers, then 4, and so on. There's lots of different suggestions here in your Bates on how to test reasoning, judgment, attention span, higher level of functioning, abstract thinking, calculations. You know, you could ask, how are an apple and an orange alike? Right here, there's that one. What's the relationship between a cat and mouse? So abstract thinking. Sometimes those are the first things to go with dementia, or the abstract thinking, and also the social cues and ability to joke, believe it or not. Some of the first things that go away in our patients with dementia and also Alzheimer's type dementia. So here's the information about the mini mental status exam that I talked about earlier and some of the sample items. This is copyrighted, so the whole exam isn't able to be reproduced in your book, but it is probably the most common one for screening for cognitive function and memory loss. So it's an important one to know for the test. For the test, you will be responsible for knowing what a normal mini mental status exam is, which is perfect score is 30 points, okay? So you need to know that and go back and read that information in your book. All right, so that was an overview of your book. If we go back to the class, that was your readings. You should also look at the video by Dr. Jessica Nishikawa, which is linked in the course. It's pretty quick video. You can play it in 2-speed if you're short on time. Attend your synchronous session and make sure you do your attendance attestation for that by submitting a statement that you attended or a summary or whatever your instructor has you do when you can't attend. You need to go online and take your quiz. And finally, your video. So you did the health history, and during that health history interview, you didn't have to touch your patient. It was only an interview. It's the exact opposite for your first video exam. For this exam, you select a patient and you do only the neurological exam. Do not ask them their chief complaint. Don't go through their history of present illness, review of systems. Don't ask them about their history. Don't do any sort of interview. The only thing you need to do in the beginning is to start with a consent. And it's a simple verbal consent. Hi, my name is Donna Stahovich, and I am a nurse practitioner student at USU. Do you give me permission to video record this exam and upload it to YouTube as an unlisted video so that my instructor and possibly fellow students may view this video? And they should say, yes, my name is so-and-so, and I give my consent. Now, if you're using your own child for the exam and your child is under 18, you need to state in the video to me that I am the parent of, Miss Lily Anderson, and as her parent, I am agreeing to post this on YouTube for my exam. If you are not the child's parent, let's say you're using a niece or a nephew, then you need to have that parent or guardian on video in the screen and consent for you to do the recording of their child and post it to YouTube. We're trying to avoid any kind of problems in the future with your patients. We don't want the videos. What if you as a student accidentally posted it as public instead of unlisted? The worst thing would be for that person to find out later about it and be very embarrassed or to have problems. So make sure you do that consent. It's part of the grade. So you do your video, then you write the findings. You document the findings. And I want to show you an example of the findings. So let's see if I can do that. Neuro note, find a neuro note. Maybe this is a good one. No, but this is the rubric, so I'm glad to bring this up. This is the rubric for the neuro exam. This is what you'll be expected to do, but really you should start out with a mental status first. And this is an old version, so this has been changed and the new one is uploaded into the course. But I will find a note here, just a second for you. CV neuro write-up. Okay, perfect. So here we have a write-up. See how long it is? It's almost a page and a half. This is what a good system write-up looks like for neuro. It talks about the mental status, the cranial nerves, motor. You do not have to do a chart like this. You can write out, simply make a statement. Deltoid, biceps, triceps, all tested 5 out of 5. Hips, abductors, 5 out of 5. Quadriceps and hamstrings, 5 out of 5. Because see, this is different than what you have to do anyway. This is just an example from the internet. The reflexes, you have to say what reflexes you checked. Sensory, coordination, and gait. Okay, so that's an example of a perfect note. So back to here. Okay, so you have your video and you have your note, and then you upload it into the assignment Dropbox, and then your instructor will grade it and give you feedback on your note. The other thing due this week is your Shadow Health module for neurologic and mental health, and you'll upload the lab pass as usual, just like you did in week 1. Okay, so I think that just about covers everything. If you have any questions, reach out to your professor. Thank you for watching, and let us know if you have any questions.